Morning, good morning, Sandeep, Soumya. I think you are getting video and audio. So this is our fourth class, fourth live class. You are getting my voice properly, getting my video properly. Kindly message me. Good morning, Susmita. Are you getting my voice properly? Kindly comment if you are getting my voice properly. Kindly comment. Okay. So I just checked. Okay. So I think you are getting my voice properly, audio also properly. So it's our fourth class, that is MCQ plus core point discussion. Today also we will discuss more things or more questions from fundamental of nursing. And before going to start our class, see Aiims Norcet exam, which is already scheduled on September month, so we don't have enough time to start studying. As I always telling you, the strategies. Again, I will tell you the strategies, the learning strategies which we are planning to follow. That is a basic and important concept study. Okay, you should have a basic and important concept study. So once you do this basic and important concept study, definitely what will happen, you can cover, or you can cover 20%. Okay, so 20% you can cover by doing the basic and important concept study. 20%. How you will do basic and important concept study? We know that you don't have enough time. We know you don't have enough time to go everything in detail, one by one, to study, to remember. So when you study, if you are studying fundamental of nursing, take fundamental of nursing, study the basics and study the important concepts. Like that you can cover 20%. Then do a systemized or subject-wise online exam practice. Suppose if you are studying fundamental of nursing, after completing the important concept study, study or do the online exam practice or exam practice. Review the questions from fundamental of nursing. So like that, you can complete 20%. Okay. Next, you can attend core points and MCQ discussions. You can attend core points and MCQ discussions. Like core points and MCQ discussion in the sense, after completing basic studies and important concept study, you can go for advanced study. Okay, you can study advanced things, advanced points. When you will study core points, when you will attend MCQ discussions, get more and more knowledge. You can brush up your basic concept. Also, you will get more and more knowledge. definitely this will help you to score more. So like that, you can another 20%. The model exam practice. Model exam practice. So model exam practice means do as much as you can. Do as much as you can. So what I'm telling you, when you practice model exams, take a model exam, practice with time management, practice with negative mark system, practice as it is a real exam. How you will perform in real exam, same way, same time management, same the techniques. Like I told you to attend the exam in different sessions. Like first you will attend easy sessions, then medium type of questions, then tough questions, like that. Keep the point that there will be negative mark system. So do like that. So like that you can complete 25%. Totally now you completed 85%, and this 85% is enough to crack or to get a good rank or to get a selection in Aims or any other competitive exam. So you got my point. So like that you have to study. It is not like you will study fundamental of nursing every day, fundamental of nursing from starting to end in detailed manner. You don't have time, only limited time. We have to complete entire 4 year of BSc or 3 year of GNM syllabus. So it's not possible to study in detailed manner. So if you know how the exam is going, how will be the competitive exam, how it is different from university exam, right? So if you know the difference, then definitely it will help you to study properly. Okay, so these are the learning strategies. We people are giving you the entire things. As I told you before, I told you that we will be giving you um, online exams. We will be giving you model exams. We will be giving you basic and important classes, concept classes, video classes. We will be giving you system-wise study materials and subject-wise exams. And we are also providing you MCQ discussions and core point discussions. So all these will help you. All these will help you to have a good preparation. Okay. We will start for the MCQ discussions. Just wait. I'll be arranging the slides now, then we will start the class. So today and here we will learn together. Okay, you got my point. Here we will learn together. I don't have time. So many people are attending duty now, and so many of you are having duty later. So we know that we don't have enough time. So we will learn here together. Okay. I hope you people started studying. So many students are doing properly. They are working properly, studying properly. But so many of you are not doing properly. I know that you are not. Sometimes only you are reading. and your interest, no, up to the mark. So please don't waste your time. If you can prepare properly, easily you can get this job. Okay, we'll start. I think some people join. A lot of people are on T now. No problem. You can watch this recorded class later on our website also, and you can watch it in our this link and in website. Okay. So good morning to all. Neuron Nursing Academy. We are providing online coaching. So this is our fourth class, Fundamental of Nursing. So I think here people are ready. So we'll start the class. So don't hesitate to give answer and all. Okay. Don't hesitate to give answer. If it is wrong also, no problem, because we people are learning. Okay. So the first question is very simple question. Very simple question. To measure an adult client apical heart rate, where does the nurse place the stethoscope? Simple question. But a lot of people, they are making mistakes in this kind of simple questions. To measure an adult apical heart rate, where does the nurse place the stethoscope? The first option is fourth left intercostal space at mid-clavicular line. Second option is second left intercostal space at mid-clavicular line. Third, third option is third left intercostal space at mid-clavicular line. And the fourth one is fifth left intercostal space at mid-clavicular line. So these are the fourth option. So kindly give your answer here. If it is wrong also, no problem. Kindly give your answer. Okay, so the first answer came from Anju Sharma. Anju Sharma is telling D. Ipsida is telling D. It's a simple, it's a simple question. Simple question. So all are telling D. Simple question. Fifth intercostal space at mid-clavicular line. So this is a simple question, but people may make a mistake. Like sometimes they may have confusion with the fourth, or sometimes they will not check this left intercostal, all those things they have given. Maybe they have given right or something. So sometimes people will not check because as it is an easy question, they will think, okay, it's an easy question. So then when they see this fifth or something in any other, like they will not check a left intercostal, mid clavicular, all those things. So you have to check. So here everything is left intercostal space at mid clavicular line. So the answer will be Correct answer will be D, means fifth intercostal space. So fifth intercostal space means, what is fifth intercostal space? Between which ribs? Fifth intercostal space means between which ribs? Tell me, fifth intercostal means between which ribs? Fifth intercostal space. The answer is D. The answer is D, fifth left intercostal space. Now a lot of people are giving a wrong answer. See, simple question. Do not make this kind of question wrong. Do not make this kind of question wrong. So it means that you need more and more preparation. You need more and more preparation, and you have to avoid mistakes. So when you read the question, read it properly. Okay. So when you practice more and more questions, you can read. So these kind of simple question, if you make mistakes, definitely you will not get selection. Don't worry. By doing practice, we can avoid all these mistakes. Don't worry. So fifth intercostal space is at midclavicular line. We'll check apical pulse or apical heart rate, and fifth intercostal space means between fifth rib and sixth rib. Okay, fifth rib and sixth rib, we will call it as fifth intercostal space, right? Okay. So before moving to the next question, I will tell something regarding ribs. Okay, so there are 12 pairs of ribs. How many pairs of ribs? 12 pairs of ribs are there. Then next, among these 12 pairs, true ribs are there and false ribs are there. True ribs and false ribs. What is true ribs? True ribs means those ribs attached directly to the sternum. Those ribs attached directly to the sternum called as true ribs. So the first 7 pairs or upper 7 pairs of ribs are called as true ribs. Okay. Then false ribs means lower 5 pairs. So if you see the ribs, the first 7 pair ribs are directly attached to the sternum. So these are called as true ribs, and the lower 5 pairs ribs, total 12 pair is there. The lower 5 pairs, they are not attached directly. They are attached but not directly to the sternum. These are called as false ribs. So lower 5 pairs. So among these 5 pairs, we can see that 3 pairs, the first 3 pairs, they are attached to sternum by joining with the cartilage of the ribs above. Okay, I will explain with a picture. So you can see here. Okay, you can see here. See, first 7 ribs. First 7 ribs. Okay, here, come here. Okay, first 1, 2, 3, 4, 5, 6, 7. First 7 ribs attached directly with the sternum. These are called as true ribs. So 1 to 7. 1 to 7 attached directly, see, directly with the sternum. These are called as true ribs. But if you see 8, 9, 8, 9, 10, then 11, 12, they are not attached. They are not attached directly with the sternum. They are attached. It's like if the eighth rib, it is attached with the seventh rib. Okay, ninth rib, it is attached with the eighth rib. 10th rib is attached with, so 10th attached with the 9, 9 attached with the 8, 8 attached with the 7. 7 is directly attached with the sternum. Okay, so 7 is directly attached with the sternum, but 8, 9, 10, These are not attached directly with the sternum, but these are attached with the adjacents, like 10 attached with the 9, 9 attached with the 9 attached with the Soumya route. Yeah, I will explain this one. Fourth intercostal space, I will explain. Um, 9 attached with um, 8 attached with the 7, okay, like that. So these are indirectly attached with the sternum, so these are called as false rib. And two ribs like 11 and 12, 11 12, they are not attached anywhere, they are not attached anywhere, I mean in the front part. Anteriorly it is not attached anywhere, back part it is attached with your spine, okay. So these are called as floating rib. Got my point? So ribs, 12 pairs of ribs are there, 12 pairs of ribs are there. In that the first 7 pair is called as upper pair, are called as true ribs, and the lower 5 pairs are called as false ribs. In this false ribs itself, the first 3 pair means 8, 9, 10. They are not directly attached to the sternum, but they are attached to the adjacent ribs, and indirectly they are attached with the sternum, okay. And last two ribs 11 and 12, they are also called as floating ribs because they are not attached with the sternum in any manner, okay. They are floating ribs, not attached with anteriorly where anywhere, okay. So these are called as floating ribs. So you should know these things, okay. The number, first 7 pair, then the last 5 pair. So regarding Soumya told that the on the previous question, she was telling that the fourth left intercostal space is actually in fourth left intercostal space also you will get apical heart rate, but the best heard, or I can say the point of maximum impulse, PMI, point of maximum impulse, or the best you can hear in at the place fifth left intercostal space. Fourth also you can hear, but the best heard or the maximum you can hear at fifth left intercostal space. So the answer is D. In children, in young children and children, you can hear very well at a fourth left intercostal space. Okay, so we have to give the best, I mean best answer. So fifth intercostal is the best answer. Okay. So I explained regarding pairs of ribs, true ribs, false ribs, important points. Okay. So you can see the picture here. Some ribs, they are directly attached with the sternum, that is true ribs 1 to 7. Okay, from 1 to 7. Then false ribs means they are not directly attached. They are attached with the adjacent, like with the 7th, 8, 9, 10 and all attached with the 7th rib. Okay. And the floating ribs are also known as, they are also a part of false rib, but especially 11th and 12th we will call it as floating ribs. And one important point. So the first rib, okay, first rib, fracture of first rib will cause, so some rib fracture. I'm talking about a rib fracture, especially first rib. Okay, so first rib fracture may cause clump-K paralysis. Okay, clump-K paralysis or clump-K palsy. Okay, so we are discussing some core points, some advanced points. So question will be there like first rib fracture may cause clump-K paralysis. So first rib fracture is one of the cause of clump-K paralysis. Not only first rib fracture, there will be a lot of other fracture, fall, especially like during birth trauma, during birth there will be some injury. So these all will cause clump-K paralysis. But you have to remember, especially the specific point you have to remember, first rib fracture will cause. First rib fracture will cause. It is one of the cause of clump-K paralysis. So we will learn what is clump-K paralysis and all. Before going to that paralysis, You know brachial plexus, right? You know brachial plexus. What is brachial plexus? Simply for your understanding, brachial plexus is a group of nerve. It's a group of nerve or plexus of nerve. So different nerves are there. It's a group. Just think about it's a group of nerve with the different branches. That's all. It start you can see in the neck region. Start in the neck region and it is extended to the axilla, to the upper arm and these areas. Okay. So this is brachial plexus. So brachial plexus simply understand that brachial plexus are a group of nerve or a plexus of nerve which is having different branches like upper trunk or upper branch, middle branch, lower branch, like that. Okay, no need to go further detail. Okay, so this is a brachial plexus, and if there is an injury to that brachial plexus nerve, if there is an injury to the brachial plexus nerve, especially if the upper plexus, I told brachial plexus is a group of nerves. There will be different branches or different trunk. Okay, so if the upper area, upper branch or upper plexus, if there is injury to the upper plexus, it will cause Erb's palsy. Okay, so Erb's palsy, how it is occurring? It is occurring due to the injury to the upper plex of the brachial plex. Okay, especially C5, C6, these nerves. Okay, C5, C6, they are getting injury. C5, C6 means upper plex of brachial plexus. This injury will cause Erb's palsy. Important point. Okay, sports injury like I told there is for brachial plexus upper, middle and lower, right? For the lower plexus injury, if the injury is for the lower plexus, especially C8 and T1, these nerve numbers are important. C8 and T1, it will cause Klumpke palsy. Okay, it will cause Klumpke palsy. Okay, easy upper Erbs, lower Klumpke palsy. C5, C6 and C8, T1. Normally, Erb's palsy you can see in birth, birth injuries. In birth injury, when the baby will come out of the uterus, when the baby will come out of the uterus, when the hand is coming outside, when the arm is coming outside, that time there will be some injury. Okay, there may be. Okay, the child may get some injury when the baby is coming out of the uterus. So this will cause Erb's palsy. So this point is very important. Maybe in image based question also you can see waiter's hip position. See the hand of this man. See the hand of this man. Okay. So this hand is like waiters, like in hotel, in restaurant you can see waiter, no? So he is asking for tip like waiter's tip position. So once you have Erb's palsy or Erb's paralysis, your hand will be somewhat like this. Okay, so it will cause upper arm paralysis. There will be problems in sensation, all those things. So waiter's hip position will cause this kind of palsy, and this position is called as Erb's paralysis. Erb's paralysis. Sorry, this position you can see in Erb's paralysis. So this tip's name is waiter's hip position. Very important. Okay, see the picture how his hand you can see in Erb's palsy. And in Klumpke paralysis, you can see claw hand, claw hand. See the hand, how it will be like monkeys, ape. Okay, so claw hand. A claw hand in the sense there will be flexion and hyperextension of phalanges, all those things. Okay, so see this one, a claw hand. You can see in Klumpke paralysis. So mainly in Erb's paralysis and Klumpke paralysis, patient will have some problems. I'll give you a general idea. They will have some sensation problem, paralysis will be there, movement problem will be there, and they cannot do some some pronation, supination, all these kind of movement they cannot do. Okay, I'm not going into the detail. So the specific points, claw hand in Klumpke paralysis, and weightless deposition in Eppes paralysis. And Klumpke paralysis will be by whom? I mean, Klumpke paralysis by lower branch, and Erb's paralysis by upper branch of brachial plexus. These are the two important injuries of brachial plexus. Okay. This question, it's a drug calculation question, and one student, she asked me this question. That's why I put this question. This discussion. Prescription is injection dopamine 200 mg in 250 cc dextrose 5. So I'm talking about a prescription. The doctor prescribed 200 mg in 250 cc dextrose 5. So this is the medicine. What is the medicine name? Dopamine 200 mg in 250 cc dextrose 5. That you have to infuse at 5 mcg per kg per minute. And the patient weight is 50 kg. Patient weight is 50 kg. How many cc per hour? So sometimes they will ask you ml, sometimes they will ask you cc. Okay, ml per hour or cc per hour. Okay, forgot this is ml or cc. The formula or this method, everything is same. So how many cc per hour would this be on an infusion? It's a simple question, but sometimes you may get time to understand the question, to read the question. You may get confused. Simple. There is a infusion. So there is a fluid. Simply, there is a fluid. Dextrose 5. It's a fluid, and in that dextrose 5, 250 cc is the amount of that dextrose 5, and in that there is 200 mg of dopamine. So dopamine 200 mg mixed in 250 cc dextrose 5. Okay, so how many ml or cc we have? We have 250 cc amount ml. Okay, then we have to, so when I am explaining, if you know this answer, if you know how to calculate it is, please do it. Please, you can do the calculation, no problem. Then doctor ordered to give 5 mcg per kg per minute. Doctor ordered 5 mcg per kg per minute, and the patient weight is 50 kg. Patient weight is 50 kg. So how you will do? First one is a drug ordered. The formula is drug ordered. Then drug available into volume. This is the formula, right? This is the formula that we have to put here. So what is the drug ordered here? I think you know this formula, drug ordered. What is the drug ordered here? Doctor ordered 5 mcg per kg per minute. Okay, 5 mcg per kg per minute. So how much we have to give in per minute? Per minute you have to give 5 mcg per kg. The patient is 50 kg, right? Patient is 50 kg, and his we have to give 5 mcg. 5 mcg. So you have to give 250 mcg per minute. You have to give 250 mcg per minute. Now I am calculating how much drug doctor ordered. Okay, how much drug doctor ordered? That is what I am calculating. So doctor ordered 5 mcg per kg per minute. So his weight is 50 kg. So I have to give 250 mcg per minute. I have to give 250 mcg per minute. But here the question they have asked. Here the question they have asked per hour. Here the question they have asked per hour. So I have to convert this into hour. So in 1 minute, if I am giving 250 mcg means in 1 hour how much I have to give? I will multiply with 60. So this much amount I have to, this is the amount I have to give. That is the drug ordered. How much? 250 mcg into 60. How much it will be? Okay, you can multiply and you can see that. Okay, so this is the drug ordered. I will do the So drug ordered is 250 mcg into 60. So this is the drug ordered. What is the drug available? Drug available, you can here see here. Drug available is 200 mg. Drug available is 200 mg. 200 mg. And what is the volume? Volume is 250. Right? So this is the formula we got now. Right? How I put? First I found the drug ordered. Drug ordered I found first. Then this is the drug available. Then this is the volume. This is the volume because it's an injection. Okay. So if I do these things, if I multiply these things, how much I will get? 250. Right? I will get mcg. Okay. 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 This much mcg, 15,000 mcg. 15,000 mcg divided by 200 mg into 250. Okay. So see here, they have asked how many cc. They have asked how many cc. Yeah, one is in mcg, one is in milligram. Okay, so we have to make all the units in same thing. One is in mcg, one is in mg, right? One is in mcg, one is in mg. So I am going to convert this 15,000 mcg to a milligram. Okay, to milligram. So you know that 1 milligram equal to 1000 mcg, right? So if I divide this one, if I can divide this one, 15,000 mcg with 1000, okay, I get 15. So here 50, now my formula is 15 mg by 200 mg into 250. Okay. Now I will convert. Now I will again. Okay. So now my formula is 15 divided by 200 into 250, right? I think this is the formula, the last formula. Yeah, this is the last formula. Okay, so if I do calculation here, 55 here, 4 here, right? So I will get 75 by 4, right? I think 75 by 4. 15 by 4. So around 70 by 54. So if I do 70 by 75 by 4, 1, 35 means 8. So it will come around 18 point something. It will come around 18.6 or 18 point something. It will come around. I think you got the answer. I think you got the answer. 18.6. So if I make it round, I can tell 19 cc because in the option they have given 19 cc. So the answer will be 19 cc. So what I did, first I found the drug ordered. The doctor ordered 5 mcg per kg per minute and the patient weight is 50. So I multiplied this 50 kg with the 5 mcg. So I got the total drug I have to give per minute. But in the question they have asked me per hour. So again I multiplied with the 60. So I got how much a drug ordered. So I got the drug ordered total. Okay, next, drug available. Drug available is 200 mg per 250 cc. So drug ordered the drug ordered is 200. So drug available is 200 multiplied by 250. Okay, in that formula I put. And then I saw that one is in mg, the another one is in mcg. So I made everything in milligram. To convert mcg to milligram, I divided that with 1000. So I got everything in mcg. Then is after doing multiplication, I got the answer. So if you know how to interpret the question, if you know how to interpret the question, easily you can answer. Okay. So it's some students they find it very difficult, but some students it's easy only. Okay. So those people who are not understand this one, please, later you can watch it in our website or in the same link also. Watch again so that you will be understand. Okay. A nurse is caring for a client whose heel has a pressure ulcer covered with intact, hard, dry, black tissue. Which is the appropriate dressing for this client? So one client is having pressure ulcer, right? So pressure ulcer, and that ulcer is covered with intact, hard, dry, black tissue. So the ulcer already covered with the black tissue, dry black tissue. Talking about the heel. Okay, this pressure ulcer is on the heel, not on the back or any other place. It is on the heel, which is the appropriate dressing for this client. And option A, no dressing is necessary. B, cover with sterile gauze. C, apply a hydrocolloid dressing. D, do a wet to dry dressing change. If you understood the drug calculation part, please message. Or if you have doubt, please tell me. We will clear it. We'll clear it again. Okay, so this question you can answer. A nurse is caring for a client who's heel. So here the important thing, pressure ulcer. Okay, I think you know how you will at bed sore, pressure ulcer, all those things. How you will assess. There is a scale. What is the scale? You can, if you know the answer, tell me what is the scale of pressure ulcer. To check the pressure ulcer, what is the scale? Its total score important. The components in that Barden scale. Sorry, all the which scale which is using. If you know, comment. You know, comment which scale is using to assess the pressure ulcer or bed sore. What are the part or components of that scale? What is the total score? What is the, I mean, the highest score and the lowest score? So these all are important. So all these are important when you study pressure ulcer. Not this pressure ulcer, though these points I told you is are basic questions, not advanced questions, basic or medium type of questions. So if now itself you can note pressure ulcer or bed sore, then just go to the Google, or if you want, you can study it from our website. Otherwise, Google it, find those answers which I asked you, okay, so that it will be, you will be able to remember. Okay, so the answer people are telling, somebody is telling B, somebody is telling A. The answer is A. No dressing is necessary. Okay, no dressing is necessary because see these things, intact, hard, dry, black tissue. This is called as eschar. Eschar. So what is eschar? Eschar means when the tissue became dead. Tissue became dead, dry, then it became in like a black color, black tissue. So this is called as eschar. Okay, eschar means there will not be proper blood circulation or anything. It's a dead tissue. But if it is on the heel, if it is on the heel, okay, this is on the heel. I told you this is on the heel. So it will work as a barrier, natural barrier. It will work like a barrier or a dressing. So no need to do another dressing in that area. No need to remove that thing. It will be, if it is on the heel. I'm talking about the heel. If it is on the heel, no need to do any dressing. Keep it like this. No dressing is necessary. What is that? Here they told it is pressure ulcer is covered with intact, hard, dry, black tissue. Intact, hard, dry, black tissue. It is called as eschar. Okay, eschar. Eschar will be working as a, because it's a like a dressing. Okay, or that area is hard and also no need to remove and you have to do dressing. Keep it like this, not dressing. Um, I think in the previous classes we have discussed regarding the stages of pressure ulcer. Stage 1, stage 2, stage 3, stage 4. So in stage 3 and stage 4 you can see this kind of scar. Okay. Scar you can see in stage 3 and stage 4. Yeah, Mamda, sorry, mouse me message 4 stage of pressure ulcer. Yeah. Epsida is telling sensory perception, moisture, mobility, activity, nutrition. Yeah, Epsida is answering. Epsida is answering. We'll check sensory perception, uh, moisture, then nutrition, shear and friction, mobility, activity. These all are the components of Barden scale. Okay, Barden scale. Anju is telling Barden scale is the scale we use to assess the pressure ulcer. There is 4 stages of pressure ulcer. Then the minimum score is 6, maximum is 23. Lowest score means less, less risk. Lowest score means less risk for the pressure ulcer. Okay, those people who don't know, kindly go and kindly read this one. Okay, and is administering intramuscular injection of influenza vaccine. Which injection technique will avoid leakage into subcutaneous tissue? So influenza vaccine, intranasally, intramuscular. Okay, these are the different route for the kind of influenza vaccines. So here I'm talking about intramuscular injection. So a nurse is administering intramuscular injection. Which injection technique will avoid leakage into subcutaneous tissue? So we are giving intramuscular injection, but there is a chance for leakage into the subcutaneous tissue. To avoid that thing, which injection technique you will use? Injection at a 45-degree angle, injection by the Z track method, or aspiration prior to injection, or massaging the injection site. So which technique will help you to avoid leakage into subcutaneous tissue? Because if there is a leakage into subcutaneous tissue, there will be a tissue irritation. Okay, subcutaneous tissue irritation will be there. So that's why we are avoiding. So we want to avoid the leakage. Staining and irritation will be there. So a nurse is administering. So which technique you will use? Okay, Mausmi, Anju, Ipsida, Sharon, all are telling injection by the Z track method as the answer. Can you tell me any other medicine which we give by using this Z track method? Any other injection name by using the Z track method? Z track method, it's an old method nowadays, like we are using, but it's like a old method. So the evidence-based practice tells that is a track method is not that much important or necessary to, or we have to follow this is a track method. So nowadays people are not giving that much importance for this is a track method. Is a track method is a kind of method for giving uh, intramuscular injection. Do you know any other medicine which we give? I told influenza vaccine I can give by using Isotrack. Any other medicine which we give by using Isotrack method? Any other injection? So the answer is a track. Answer is B, is a track method. Is a track method. Because when you do is a track, I will tell you what is a track method later. But if you do you know any other injection name which we are giving by using this is a track method? If you know, just comment. No, CSF collection process. Asking about the injection. Haloperidol. If she is telling haloperidol, the meaning is iron injection. Iron injection. Dextran. Iron injection. Iron injection. We will give by Z track method. Iron injection. Iron injection. Okay. Yeah, Sharon is telling iron. So here you can see Z-track injection method. It will avoid leakage into subcutaneous tissue. So what you will do means you want to tight the skin. Okay, before giving injection, you have to stretch and tight the skin. For that, you will move the skin downward. You are giving in hand or buttocks anywhere. Okay, you will tight that, stretch that area by moving the skin downward or upward. Then by using a direct 90-degree angle, you will give the injection. Okay, so you will just tight the skin. Then you can see in the picture, you will pull the skin to downward or upward in any other direction. Then you will put in a 90-degree Z track method. Okay, Saum is telling dextrans we are giving. Anju, dextran iron injection we can give. Okay. What is the smallest gauge intravenous catheter? I mean IV catheter that can be used to administer blood. Okay, so here they have given you four options: 24, 26, 22, 20. Okay, so among these, which catheter, that catheter which we will use for blood? Okay, so administering blood, we will use that catheter, and in among these, which of these is having smallest gauge? Smallest gauge, but it should be used for administering blood. Okay, the smallest gauge simply I can say 24. Smallest gauge is simply I can say 24, but the question is that smallest gauge IV catheter that can be used to administer blood. For administering blood, which one you will use? For administering blood, which one you will use? Smallest gauge I need. These kind of questions, no, I told you, no, after studying basic concepts, when you study basic concepts, important topics, sometimes you will not be come across with these kind of points. So that's why I told you, after that you will practice with online exams 2-3 times, same exam 2-3 times. When you will attend MCQ discussions, then you will practice lot of model or mock test. So all together you will be able to answer a lot of questions. Now itself, Lot of people, when we put this question on the screen, they are understanding. They are understanding, or they know the answer. It is it is because they prepared in a such a way previously. So same way, you will also understand. Sometimes now you may not be able to understand, or you may not be able to answer, but step by step you will be able to understand. So for this, no need to go. No, some students, you know how they are studying. They will take the book. Okay, you can answer in between. You can answer. Okay. Meanwhile, I'll tell you how the students are studying. They will buy some books. Lot of books are available. Or sometimes they are thinking that, okay, I want to study in a detailed manner. Every time I'm telling, still I'm repeating. They will take the book, big book. By seeing that book, you will get sleep. Big book they will take from the word first. The word first they will start. From the word first, they will, they will start in a detailed manner, one by one. There will be a lot of things you have to by heart. They will by heart. They will study, but before exam, they are forgetting. So don't do that. The questions, everything is different. This kind of practice will help you one by, like, day by day. It will help you to close to that selection. Okay, you will be very close to that selection. You are don't be get disappointed, like if you are not getting in the first select first exam. I mean, the first committee exam, if you are not getting, try again, but continue your study. Definitely you will move towards that one. Definitely you will get the selection, definitely, because you are not leaving your aim or ambition in between. Like after failing in one exam, if you are not leaving, okay, if you are not leaving means, if you are not leaving means, definitely you will get. It's one of the best job, central government job, best job you can get. If you are a nurse, if you are working in India, the best job is in central government job. To get that thing, if you don't have that much knowledge, if you are not a genius, if you are not a good student when you are studying, don't, no worry. Follow what I told you now. Follow these things step by step, you can answer. Okay, so people are telling A, somebody is telling A, somebody is telling C. Okay, so I told you that administer blood. For administering blood, okay, for administering blood, the answer is D. The answer is D. See, 24 gauge, 26 gauge, all these things are, I know that it's a smallest gauge, smallest. Like we will use it for, for um, children, old people, those veins are very thin. These things we will use 24, 26 and all. Here I asked smallest gauge of intravenous catheter that can be used to administer blood. For administering blood, repeatedly I told you, for administering blood. Okay, Anju is telling that I was doing like that, but after your advice, thank you, Anju, because I had a discussion with Anju. So if you feel or if you need counseling, like it's not like counseling, I can tell you. You can WhatsApp me. I can tell you whatever the experience I have, the knowledge I can share with you. Definitely will help you, because a lot of people are going in the other way and they are not practicing or studying properly, so they are not getting job. So, and they're working the whole life in a private hospital and suffer. So you have to suffer a lot if you are in a private hospital. You have to work a lot. You will not get the salary. So when you have a good option, another option, go behind it. Definitely you will get. Definitely. Okay. So I asked you smallest gauge. So smallest gauge, as you tell, it's A. Okay. But I told you to administer blood. To administer blood, will use like 18, 20, okay, 18, 20, 16 and all. Okay, so because we need a large bore cannula like that. Okay, large bore cannula we need when we administer blood products. Otherwise there will be hemolysis. If you use the small gauge one, there will be hemolysis. So 16, 18, 20 and all we are using for administering blood. So among these, the answer will be 20. Among these 20, these all are not using for, mainly we are not using for administering blood. We are using for giving IV fluid, but not using for giving blood. So the answer will be D. Answer will be D. Okay. This kind of tricky question, easy question, but kind of tricky question will be. The nurse is educating the parents of a young child with a recent diagnosis of cystic fibrosis. So a child is having cystic fibrosis and a nurse is educating. A nurse is educating the parents regarding cystic fibrosis. The nurse tells the parents that the child will be at risk for which vitamin deficiency. So nurse is educating and telling that this child, because this child is having cystic fibrosis, this child will be having some vitamin deficiency. Among these, which vitamin deficiency the child will be having? Option A, vitamin B1 and pantothenic acid. Option B, folic acid and biotin. Option C, vitamins A, D and K. Option D, vitamins B12, C and E. Mostly, uh, Mostly, okay. Thank you for your nice comment, for the appreciation. Anju's telling 18 also used. I think she said 18 also. Yeah, 18 also used, but uh, in the in the option they didn't mention 18. That's why we put 20. Okay. So tell me, the nurse is educating. You can tell me which vitamin deficiency will be having for a child who is having cystic fibrosis. So you have to keep remember cystic fibrosis. If you know the concept, that's why I told you. If you know the concept, no need to have the entire detail about cystic fibrosis. But if you know what is cystic fibrosis and some specific points, exam points in the cystic fibrosis, and if you know the concept, easily you can answer this one. Okay. So what will be the answer? What will be the answer? House me is telling B. No problem. Comment. Is wrong, no problem. No one is perfect. No one is perfect. See, when I am teaching you this one, do you think I am a perfect person? Do you think I know all those things? No, I am referring, then I am coming and teaching you. What I do is, I am taking some questions, important questions, and just presenting you in front of you. I'm learning this one before you, then I am presenting you. That's all. I am not a perfect person. No one is perfect. No teacher is perfect. All the teachers, they are studying, then presenting in front of you. Just to help you, just to motivate you, just to, sometimes in some concept may be difficult for you. If somebody is explaining that, it will be easy for you. So that is the thing I am doing in front of you. Okay, so my duty is just helping you. Okay, you got my point. So if it is wrong, if you fail, you make mistake, don't worry. We all are making mistakes. The mistakes which I made in my life, that I'm telling you. Okay, so I these are the mistakes I did. Don't do that. Okay, and you will also learn a lot of mistakes from your life. Don't do it or don't repeat it later. Okay, so every day, please study. Every day, please study. So these points. Now I will tell you some points regarding cystic fibrosis, and it will be in your mind. In the exam, it will help you. So now you are finding sometimes. Now you are finding sometimes. You are studying. Continue these things even after Aiims Norcet or NIMHANS. exam also, continue these things, continue this thing till you get a job. Maybe you will get in the next Aiims Norcet. If you don't get, don't worry, check your rank. In the next exam, you will improve your rank. Like that. You have time. Decide, you will get it. For this, don't think that okay, you may not compare yourself with other students. Like okay, she is studying, she is genius, that's why she got. No. If you follow these things, everyone will get the job. Those who follow, they will get it. Those people, they are not getting because they are not studying properly. That's why they are not getting. It is not because they are not having that much knowledge. No, they are not preparing in a proper manner. That's so simple. Okay, the answer is C. Answer is C. Vitamin A, D, and K. You know what is the Sharon is telling C, Saum is telling C. What is the speciality or the specialty? I think I can say specialty. Vitamin A and D, A, D, and K. There is water soluble. There is fat soluble vitamins, right? A, D, E, K, A, D, and K. These are fat soluble vitamins. These are fat soluble vitamins. So some relation is there with the fat absorption or fat and cystic fibrosis, all those things. Okay, so let's see here. I'm telling you some important points regarding cystic fibrosis. The people who are having cystic fibrosis, they will have problem in absorbing fat. So they have malabsorption of fat. They cannot absorb fat properly. So if when they do not absorb fat properly, they cannot absorb fat soluble vitamins, right? Cystic fibrosis people are having problem in absorbing fat, digestion and absorption of fat. So they cannot absorb the fat soluble vitamins also. So A, D, E, and K, they are the fat soluble vitamins. So when someone is having cystic fibrosis, they cannot absorb these fat soluble vitamins. B complex, C, folic acid, biotin, pantothenic acid, all are water soluble. So that's why the answer is C, means A, D, E, and K. So these people will have fat soluble vitamin deficiency, means A, D, E, and K deficiency. See some points regarding. You know what is uh, cystic fibrosis? Cystic fibrosis is an autosomal recessive disorder. Autosomal recessive disorder. It means that, okay, there will be dominant and recessive trait. Like, okay, dominant and recessive trait. So, if one person, if mother is having this gene and father is not having gene, means the child will be a carrier. Carrier in the sense they will not have any problem, but they are a carrier. Mother and father both gene are having cystic fibrosis problem, defect in the cystic fibrosis gene, then only the child will get problem. If one is having, mother is having problem, father is normal, means the child may be a carrier, not having disease. Carrier means no symptoms, no problem at all, but carrier, like they can transmit to other next generation. If mother is having and the father is also having same gene, and when this gene, cystic fibrosis defect gene, and when these genes both are in child, means child will get cystic fibrosis. Okay, so that's why I told cystic fibrosis is a autosomal recessive disorder. It will affect the respiratory, gastrointestinal, reproductive, and exocrine, all these gland, all these cells. It will affect these cells. So there will be increased production of mucus. So there will be increased production of mucus in the respiratory system, gastrointestinal system, in the pancreas. So what will if it is there is increased production, thick mucus production. If it is there, means what will happen? Then the patient will have a respiratory problem, right? If there is a thick mucus production in the pancreas means there will not be proper no proper secretion of enzymes, right? Patient may have insulin problem, digestive enzyme problems because the respiratory system, gastrointestinal system, reproductive tract, all these things are um, blocked because of the thick mucus. Thick mucus. Why this thick mucus is producing? Because their gene, they have an abnormal gene. Okay, they have an abnormal gene. So you got what is cystic fibrosis. Okay, yeah, as Sharon Couture is telling that fat is passed. Okay, fat cannot be absorbed. These people in these people, they fat cannot be absorbed. Why means there is no enzyme or because the pancreas, all these things are the secretions or these digestive enzymes are thickened or blocked or they cannot secrete because of this thick mucus gland, this thick mucus. There will not be no proper no enzymes, digestive enzymes like lipase. If there is no lipase, cannot break down, cannot, if there is no proper secretion of lipase, you cannot break down the fat. So you, if you cannot break down the fat, you cannot absorb it. So fat soluble vitamins, you cannot absorb it. Even you cannot absorb fat because there is the enzymes or the pancreatic enzymes, the digestive enzyme is secreting, okay, like lipase, it will not be available because of this thick mucus gland. So there is no proper digestion. So the the fat will go, malabsorption will be there, fat will go through your stool, it's called as steatoria. If increased the fat content in the stool means called as steatoria. Steatoria you can see in X1 is cystic fibrosis. Cystic fibrosis. Okay. Then next, so you got what is cystic fibrosis. Then cystic fibrosis G. Okay, chromosome 7. Okay. So cystic fibrosis is due to mutation in the cystic fibrosis gene on chromosome 7. So understand chromosome 7. Remember this point. Next point is the cystic fibrosis gene encodes a protein. Okay, so the gene encodes a protein. The name is, the protein name is cystic fibrosis transmembrane regulator, CFTR, cystic fibrosis transmembrane regulator. So cystic fibrosis is a autosomal recessive disorder. One thing you have to remember. Then chromosome 7, second thing you have to remember. Then cystic fibrosis, transmembrane regulator, CFTR. These three things you have to remember or you have to relate with cystic fibrosis. Okay, fine, fine. When cleaning the perineal area around the site of an indwelling catheter, the nurse should. Simple question. When cleaning the perineal area around the site of an indwelling catheter, okay, indwelling catheter, the nurse should: 1. Scrub the tubing toward the urinary meatus, vigorously wash the periurethral area, wipe the catheter away from the urinary meatus, apply powder after giving the perineal area. Okay, simple question, all of you know that because it's a basic question. Even if you don't know the answer, you can eliminate something, right? Eliminate this point. Vigorously wash the periurethral area. Right, vigorously. No, never and ever I do vigorous washing because it will cause injury, no, irritation. So vigorously, no, we cannot wash vigorously. I can eliminate this one. I can eliminate this also. I will not put powder or something on the perineal area. Like applying powder, it will cause some infection. In the sense, it will absorb moisture. There will be infection. So now I have doubt over option A and option C. Scrub the tubing toward the urinary meatus or wipe the catheter away. One is towards the urinary meatus. I think you know what is the urinary meatus, urinary opening. Towards the urinary meatus or away. Towards or away. Like this or like this. What you will do? So I have confusion in A and C. So if you have confusion in like this is a simple question you will not have, but example I'm telling, if you have, do like this when you, whenever you answer, do like this, so easily you can no 50-50, now 50-50. Okay, you have more chance to make it correct. Before 4 option only 25% was your chance, now your chance is 50-50, right? 50%. Okay, or are telling, see, wipe the catheter away from the urinary. Yeah, to avoid the contamination. To avoid the contamination, away you have to do. No, like less contaminated to more contaminated, like that. You know that thing, right? So wipe it away. Wipe it away from the urine. So the answer is C. The easy question. Yeah. Mausmi, Anju, Krishna Rani, Sida, Sharon, Ganguly, all are telling. Good. A patient diagnosed with Crohn's disease and has a new colostomy. When assessing the patient's stoma, which of these alert the nurse that the stoma has retracted? Somewhat a difficult question. Like one patient is having Crohn's disease, right? And after Crohn's disease, now patient is having colostomy. Colostomy. Patient is having colostomy. And now we are assessing the colostomy, that stoma we are assessing, and which of these would alert the nurse that stoma has retracted? So you should know what is retracted. Stoma has retracted. What is the meaning? You should know. Okay, and you should know how it would be a normal stoma will look like. And how the normal stoma will look like. You should know what is that. Abnormal stoma, how it will look like. Then what is the meaning of retracted stoma? So if you have some idea, easily you can answer. Okay, you can give the answer. So the answer is answer A, concave and bowel shaped. Concave and bowel shaped. What is concave and bowel shaped means? So this is convex. Outside convex. It is like this, convex. Sorry, concave. This is convex, like protruding outside. This side means concave. Okay, so first you have to understand this, what is concave and convex. Okay, you got what is concave and convex. Next, see here. First of all, a healthy stoma after colostomy, a healthy stoma will protrude outside. So if you know what is colostomy, colostomy means what, you are in the abdominal wall, you are making a hole. Okay, you are making a hole and you are pulling out some of the intestinal content, bowel, you are pulling out. So the through that bowel, through that intestine, through that intestine or the bowel, the stool will come outside, right? So this is the abdomen. Sorry, this is the abdomen, and here you will making a hole. Through that hole the stool will come out, so some part will be outside. Okay, if you see the normal colostomy, you can see the colostomy, that stoma in the sense the intestinal content, intestine or bowel will protrude outside 2.5 centimeter, and you can see open lumen at the top. Okay, 2.5 centimeter it will protrude, so like convex, it will be outside. You can see something bulging outside from the abdomen. 2.5 centimeter will be outside. That is the healthy stoma. And if the stoma is healthy, normal means it should appear red, pinkish red and moist, not dry, not any other color. It will be pinkish red and moist. Pinkish red and moist means there is enough blood circulation. It is normal. So in the option, you saw pinkish red. Right, so pinkish red means it's a normal one. It's a normal one. Next, a dry, dusky or reddish purple stoma indicates ischemia. If you see a reddish purple stoma, and the color now changes, not pinkish red. Now it is a purple, reddish purple, and it's a dry means it indicates ischemia, means there is no proper blood circulation to the stoma. Okay, you got the difference. Then a narrowed or flattened. I told you that the stoma should be outside of the abdominal walls, 2.5 centimeter outside of the abdominal wall. If it is narrowed or narrowed, means it should there will be open lumen. It will be outside. If this is the abdomen, if this is the abdomen, hope you can see. It will be protrude like this, somewhat protrude like this. But if it is not protruded, it is flat and there is no hole, you cannot see. The hole is constricted or narrowed. It means the stoma is having stenosis, means the passage of the stoma, the hole became small, constricted, stenosis is there. Okay, this is also not normal. And concave and bowl shaped stoma means concave and bowl shaped, sorry, bowl shaped, concave and bowl shaped, like bowl. Okay, concave shape I told you now before. Okay, for inside, protruding inside. Okay, this is concave. This is concave. Concave means what? Inside, going inside. So concave means concave shape means it is retracted, going inside. Okay, so that is the meaning of retracted. Okay, see here the stoma, you can see it's inside, no? Inside, not protruding outside. It is going inside. Okay. So retracted stoma, you know what is retracted stoma? The shape will be concave, I told you, and in bowl shape, I told you. Then normal stoma will be outside, protruded outside, 2.5 centimeter, and there will be open lumen, open hole. You can see through that the feces or uh, uh, the stool will come. Then will be red pink, pinkish red. If it is and it moist, it is normal. If it is a dry purple reddish means ischemia. Narrow or constricted means stenosis. Okay, all these points you have to remember. Very simple question. Which lab value indicates hypokalemia? Which lab value indicates hypokalemia? Normally, sometimes what will happen? People will study all the important, the difficult concepts and all, and they will leave these kind of simple questions. Simple questions. Okay, they will leave these kind of simple questions. Tell me what will be the answer. Which lab value indicates hypokalemia? Those people who would like to join our online coaching for getting, as I told you, model exams, then important concepts of video classes, then mock test, all those things. You can join. You can visit the website. You can see the website name is scrolling down here. Also, there is you can see the WhatsApp number which is scrolling down. So you can contact in this number. And those people who are already in the online coaching, if they find any difficulty to access the course or class, please message me. I can explain you easily. So the website you can use easily. It's very easy to use. Question is regarding lab value which indicate hypokalemia. Do not do mistakes. Okay, these are simple. Okay, simple questions. So this question, all of you know these questions. Easy questions. 3.5 to 5 milligran per liter, we can tell as normal potassium level. So below that, hypo, above it, hyper. Okay. So 3.2 means hypokalemia. Simple question. Okay. Then in some questions, they will not ask you which is hypokalemia, which is hyperkalemia, what is the normal value. They will not ask you like this, but you have to study the lab value, and in some questions they will give you a condition of the patient, and they will ask you in which condition you will take immediate action, or as a nurse you will take action, like that they will ask you. Like they will give a sodium level, they will give you potassium level, they will give you some troponin level, they will give you ammonia level, urea level, all those things. They will not ask you hypo which is higher or lower or something like that. So they will give you 3 to 4 lab values, and they will ask you which you will take action. So you should know all the lab values, and you have to check each lab value. If it is sodium, what is the normal sodium? Okay, this is sodium normal, potassium normal, or there is a problem in protein or albumin. So there is a problem. So I will take action upon this lab value. Like that also you have to check. Okay. Answer B 3.2 is hypokalemia. A client with the CRF. Okay, so one client is having chronic renal failure, is learning to perform peritoneal dialysis at home. The nurse instructs the client to warm the dialysing solution to 37 degrees Celsius so that it will. So one nurse is telling that you have. So one patient is having a CRF, and the nurse is giving instruction to the client that you have to warm the solution, peritoneal dialysis solution, to 37 degrees Celsius, so that, like, why we have to what will be the answer of before question? Mouse me asking what will be the question answer. 3.2 is the answer. If you are asking about the hypokalemia, 3.2 milliequivalent per liter will be the answer. I think mouse me asking for this hypokalemia. Okay. So this question, a client with a CRF is learning to perform peritoneal dialysis. I'm sorry, peritoneal dialysis. So why the patient has to warm the dialysing solution? Option: to dilate the peritoneal blood vessels. Second, to relax the abdominal muscles. Third, to remove toxins from the body cells. Fourth, to maintain a constant body temperature. Maintain a constant body temperature. So if I don't know the answer also, see, I will remove this point, remove toxins from body cells. By doing warming, I cannot remove the toxins from cells. No, it's not related. So C will not be the answer. So now I have A, B, C. Dilate the peritoneal blood vessels, maybe. Relax the abdominal muscles, maybe. Maintain a constant body temperature, maybe. There is chance. These three, there is chance. So in this case, if you ask me, yes, to maintain a constant body temperature, you can warm the solution, but we have to give the best response, best answer. You have to answer. In some cases, there will be different options may give this, we feel that these are correct, like maintain constant body temperature. Yes, of course you can do it, no problem in that. But multiple choice, they are asking the best response, best answer. So all are giving D, 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 D. But the answer is A. The answer is A. I told you can warm the solution to 37 degrees Celsius to maintain a constant body temperature. It's okay, right? But the important thing, the first priority, or first best response is, or the first indication is for dilating the peritoneal blood vessels. You have to dilate by warming the solution. You can dilate the peritoneal blood vessels so that there will be good or more easy transaction or transfusion or exchange between the blood vessels or blood and the I mean the peritoneal blood vessels and the um, dialysis solution. Okay, so the answer is A. I think you got point. Okay, so almost 1 hour and 30 minutes finished. So here we are going to stop the class. So thank you for attending Neuron Academy MCQ discussions with core point. Again, we will come with free class. This class, those people, our online coaching students, it will be available in the website later. I will be adding that. And those students who would like to join our uh, coaching, or if in online coaching, they can WhatsApp me, they can visit our website. And those people who would like to get free class like this kind of class, we will put free classes also. So to get that free classes timing, notification and all, you can WhatsApp me, so that I will be adding you to a group. From that group you will get notification of the free class. Hope you got some points, you learned something. This 1 hour, 1.5 hour, you learned some points. Like we learned about cystic fibrosis, we learned about different type of uh, uh, brachial plexus injuries, we learned about some stoma. Okay, so something you learned again. No need to study these things again because you already learned these things. Every day practice model exams, study, find out some times to study in a systematic manner. You study. Exam will be in September. Aims exam will be in September, and definitely, if you can prepare properly, if you can spend some time for your future, like you are spending a lot of time, you are giving a lot of energy to private hospitals or private institutes where you are working. Give some time for your life, your future. Definitely, you can change your future. You can have a good future. I mean, in the sense, good job. Job, a secure job you will get with a good salary. Okay, so uh, please continue your study. So thank you for attending. Those people, again, I'm telling those people who would like to join, they can join. Also, you can attend our free. We will be giving you free classes also. Free classes also, because some students, they are in some coaching, so no need to join another coaching. But you can use our things, because I think you will be getting some things from us also, like from free classes also. You will get some points, some important points. So continue your study. Don't think about the result. So, like whether you will succeed in the exam, you will fail in the. Don't think about it. Take it as a challenge. Attend every exam. So again, I will tell you. I'll tell you one tip for the central government exam selection. Thing is that continue your preparation, like in what I told you, like that. Okay, not like you, I am telling you to study every day 6 hour, 8 hour, 9 hour, 10 hour. No, I'm sure it is not possible. But if you are studying for 1 hour or 2 hour, continue it regularly. In between you can take some break, like if 1 day, 2 day you can take break if you have too much work or something. But do it continuously. Then apply all the exams. Don't think that okay, it is far, or I'm not interested. Don't think about it. Apply all the exams. You don't think that okay, you exam fees will be high. Don't think that. Apply all the exams and attend all the exams. Step by step, when you attend one by one exams, your score, your knowledge, your everything will be changed step by step, not in one day. Okay, this is the thing you have to do to get a central government. Nothing, nothing else you have to do. You have to do continuously attend exams, real exams. Study regularly, not in a don't think. Some people know they will thinking that okay, 5 to 6 hours every day. It's not possible. It's not possible with me. Like that, they are thinking and they are leaving these dreams. 1 hour, 2 hour, you can study. At least you can study 1 hour, 2 hour, 2 hour. Do it every day. regularly, systematically, then attend all the exams. Don't think about the result. Attend, and you will get it. Definitely, you will get it. Okay. So this is the tip. Today's tip. Okay. Thank you for attending. Okay. I will be informing the next class, be notifying you website as well as in the WhatsApp. If you have any doubt or any comment or anything, you can message me. And one request: a lot of people, they are not aware about our this kind of free classes and coaching. So those people, you have colleagues or juniors, seniors, or those. If you can inform them. You can inform them that like there is this kind of class is going on, so you can attend. Because many people, they do not know about these things, they are not preparing, and I am getting lot of messages like was not aware about these classes. So please inform them. Please inform. It will be helpful for those students who are interested to, and you can also help them to change their future, right? Because when you give some information to them, they may try to change, they may try to study, and definitely one day maybe their future will be changed. So